So the Medicare, Medicaid, Social Security, payments on interest, the CBO estimates are going to consume 100% of federal government revenues within 20 years. I think it's going to be sooner, especially if we don't get any cost reform in the entitlement programs. Do you think this gets done? Do you think we get something on health care? Or do you think nothing gets done, let's move on to tax?
Well, what I'd like to see is come back with a bipartisan bill that begins to look at the cost of health care. And this bill does not really address the cost of health care and making the care more efficient and actually attacking the issues that are driving up the cost of health care across the country.
Well, that's the biggest issue, though. Why wouldn't this bill address that? I don't understand this.
Yeah, and when are we going to see some tort reform in health care?
That's also something that you care a lot about.
Tort reform is going to be hard because most of the people in Congress are lawyers, and that biggest estimate, that's probably 4% of the health care costs across the country, but certainly it's a step in the right direction.
So what do you like in this bill? I mean, in terms of, you mentioned Social Security, Medicare, and Medicaid. We have this discussion about Medicaid every morning, how the Medicaid entitlement program is the fastest growing, that it's gotten so huge. So do you like the fact that they're trying to slow down the growth of Medicaid? What can be done to actually reverse the fate of these government programs, which we know are going insolvent?
Well, the government programs, I think, are going to be insolvent unless we deal with those two things that I talked about, the efficiency of looking after people who are sick and the growing problem of the unhealthiness of the U.S. population. That is the root cause of the problem, and we're not getting to the root cause of the problem by moving money from one area to another.
And the work requirement, what do you think of that in terms of mitigating or reining in or block grants to the state? Those are two components of the Senate bill that I thought were very worthwhile.
Well, well, the work requirement depends upon exactly how disabled a person is in many cases, so that's going to be tough to administer, I'm concerned about. But in terms of block grants, that will limit it, but, I'm concerned also that you're going to have one health care delivery system in one state and different in another state. For example, you may go to Pennsylvania if you don't get coverage in New York State. So it seems uneven. It's great to think about.
That's self-correcting potentially. That if you have one state that does it well, that if you draw, and it's a lower cost state in general, and you draw people across the state line, it forces the state that's not administering Medicaid well to tighten up.
I think that's exactly right. That's the experiment, a state-by-state experiment that you hopefully will get improvements by individual states.
But the idea that we don't have anything in here for wellness, getting ahead of disease, given that that is the core problem here, much of the disease and sickness when you're older happens as a result of behavior.
Well, I guess
diet, exercise?
Yeah. Well, there are two things that you have to consider. The cost of health care is going to go up, and it's going to go up for two reasons. One, we have more older people, and people are living longer. And two, there's more things we can do for people. And those are, you can't treat cancers that we are now with great drugs and not expect it to cost more. You can't do face transplants and not expect that it's going to cost more. So the technology is going to continue to grow. Every country in the world is dealing with the same problem, the escalating cost of health care.
Wow. Great to see you, Toby. Thank you so much for joining us.
Nice to be here.
Really great to get your insights, as always. Dr. Toby Cosgrove.